So there's an article in the New York Times today that I think is absolutely worth talking about. The article is titled, Medicare Advantage Plans Often Deny Needed Care, Federal Report Shows. So they've done an investigation into managed care plans and how they function within the Medicare world, and primarily pre-authorization. So something I find very important. Going to go through that right now. I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. Can absolutely help you as well. The best part is there's no cost to allow me to help you. So hopefully you'll take advantage of all my information that I have available. Right now we're going to talk about this article that's in the New York Times. I have the link below the video if you want to take a look at the article yourself. But it's pretty damning and it's pretty concerning. And with Medicare Advantage plans, if you're just coming into Medicare, you're just becoming kind of exposed to Medicare Advantage. And most people only see all the commercials on TV telling you how wonderful it is and how many free things they're going to give you and how easy they make it. And obviously they're selling Medicare Advantage because there's big money in Medicare Advantage. So what to understand about it, I'm going to go through this article, but if you choose a Medicare Advantage plan, it takes you from Medicare to a private insurer. So all those Medicare Advantage plans are owned by private insurance companies, and it takes your claims responsibility away from Medicare and gives it to the private insurance company. So they now are in charge of your claims. So it's in their best interest to limit the amount of money they spend on your claims. The less they spend, the more they make. So let's take a look inside this article and see exactly what they found. And this is no real secret, but just most people don't ever get to hear about it. So the article starts off, every year, tens of thousands of people enroll in private Medicare Advantage plans are denied necessary care that should be covered under the program, federal investigators concluded in a report published on Thursday. The investigators urge Medicare officials to strengthen oversight of these private insurance plans, which provide benefits to 28 million older Americans, and called for increased enforcement against plans with a pattern of inappropriate denials. So in the long and the short of it, if you're familiar with my channel, I recently did a video that was entitled Why I Would Never Choose Medicare Advantage. And you can find that video right here. You can click on it. I highly recommend that you watch it. Right now it's got over 700,000 views. So at least it's getting out there and people are watching and understanding the difference between original Medicare and Medicare Advantage. But that's one of the main reasons why I personally would never choose Medicare Advantage, is I don't want to ask for permission. If you're having something done, especially something serious, why in the world do you want to ask for permission from a private insurance company if it's okay? Will they authorize it for you to be able to have it done? Your doctor says you need it, but guess what? That's not enough. You have to ask permission from the Medicare Advantage company. So back to this article, the industry's main trade group claims people choose Medicare Advantage because, quote, it delivers better services, better access to care, and better value. That's certainly what you hear from Joe Namath and William Shatner and Jimmy Walker on all those television commercials. But federal investigators say there's troubling evidence that these plans are delaying or even preventing Medicare beneficiaries from getting medically necessary care. Why? Because it's financially in their best interest is the primary reason. Again, they get X amount of money from Medicare to take your claims responsibility away from Medicare, and then however much they spend on you goes to your care. They're required to spend 85% on medical care, but the more they don't spend, the better it is for the Medicare Advantage plan. So it's just a very difficult situation, and you have no recourse. So there are appeals process. We'll talk about that in just a second. But what are you going to do? You know, if they say no, what are you going to do? Tens of millions of denials are issued each year for both authorization and reimbursements. And audits of the private insurers show evidence of widespread, persistent problems related to inappropriate denials of services and payments the investigators found. So this is not somebody, you know, in my other video, I have agents that sell Medicare Advantage accusing me of misleading people and not giving a straight story. This is coming from federal investigators. So this is not my investigation into Medicare Advantage. It just kind of solidifies the way I feel about Medicare Advantage. And again, asking permission. Investigators estimated as many as 85,000 beneficiary requests for prior authorization of medical care were potentially improperly denied 2019. 85,000 requests. Now, doesn't mean a whole lot to you unless it's your request and unless you have something significant in your life going on, whether it's cancer or whether it's something terminal or major, and your doctor says you need this, and the Medicare Advantage company says, we're not paying for it. So it's a huge, huge issue that you need to understand when you make this choice that you need to be comfortable with. And I absolutely understand cost is an issue coming in. So Medicare supplements have a monthly premium. Medicare Advantage plans a lot of times do not. But the ones that do not will have a whole lot more of this denial than ones that do. And they'll also have a smaller network of doctors and hospitals, things of that nature. So back to the article, the healthcare lawyer, so they show an example in the article, and by all means, read the article. They talk very specifically about one person's scenario and what was denied and how it was denied. And the healthcare lawyer for the family in the article says people should know what they're giving up if they go into Medicare Advantage. And he's a healthcare lawyer, and he's also the son-in-law of the person that is the example in the article. People signing up for Medicare Advantage are surrendering their right to have a doctor determine what is medically necessary. He said, rather than have the insurer decide. So when you go into Medicare Advantage, so if you're on original Medicare, let's back up to that. So original Medicare A and B, and you have a supplement, you go to the doctor says you need this, you need that, you need whatever it is. If it is medically necessary, that's it. Medicare does not play a role in determining whether or not it's going to be approved. There's no pre-authorization. There's no asking for permission. So if it is medically necessary and your doctor says you need it, you do it, and Medicare pays for it. Other side of the coin, Medicare Advantage, completely different scenario. If your doctor says, and I can tell you if it's something significant, and I've been into the situation, and most of us probably have on our regular insurance before Medicare, if you are in a managed care, HMO, point of service type situation, the doctor says, we need to do this, but first we got to see if we can get it approved. And that's going to probably take a couple of weeks. So we're going to have to submit it for approval, and then if it gets approved, then we can go ahead and do it. That's a crazy way to run healthcare. If your doctor thinks you need it, and obviously there could be financial incentive on the doctor side, but most of the time they are trying to get you where you need to be on figuring out whatever your scenario might be. So, difference between original Medicare, Medicare Advantage, pre-authorization with Medicare Advantage, no pre-authorization with original Medicare. Number one reason that I would never choose a Medicare Advantage plan, personally myself. Now, back in the article, the federal government pays private insurers a fixed amount per Medicare Advantage patient. Usually it's about $1,000 a month. So Medicare pays about $1,000 a month to a Medicare Advantage plan to take your claim responsibility away. That's a lot of money. So that is when you get thousands and hundreds of thousands of people going into a plan, $1,000 per month every month is a lot of money. If the patient's choice of hospital or doctor is limited, and if he or she is encouraged to get services that are less expensive but effective, then the insurer stands to profit. So in other words, so if they tighten up a network and have fewer doctors, fewer hospitals, so they don't pay out as much money in that scenario, and you're encouraged to get less expensive treatment, generic drugs versus brand name drugs, things like that, or physical therapy versus actually doing something to correct the problem, it just benefits the profit of that private insurance company. Under traditional Medicare, in the article, there may be an incentive for hospitals and doctors to overtreat patients because they are paid for each service and test performed. So where Medicare Original pays a doctor to do their stuff and to do their stuff well, it could lead to doctors doing too much stuff. But if I'm in a medical situation, I'm looking for too much stuff. I'm not looking for cutting costs, cutting corners, saving money. But the fixed payments given to private plans provides the potential incentive for insurers to deny access to services and payment in an attempt to increase their profits. the report concluded. So this federal report concluded that the way things are paid, and a lot of times in a Medicare Advantage plan, they pay a doctor X amount of money per patient per month. So if he gets so many patients per month, he makes X amount of money whether you come in or whether you don't. And that's also problematic because they'd really rather you not come in because they're getting paid no matter what. So if you go to make appointments, you end up finding, wow, what? 2 months. That's the first availability is 2 months down the road because they're capitated. They're getting paid per person per month because that's your primary care physician. Another crazy way that things work with managed care. So I wanted to give this article some light and absolutely download it, read it, share it. But it's important to understand the differences in Medicare because we have a choice. When you had your work insurance, you probably didn't have a choice. You pretty much had an HMO plan, or you could upgrade to the point of service or PPO that gave you a little more doctor hospital choices, but still had the private insurance company making the decision whether they're going to pay for it or not pay for it. And there's very little ramification. There is talk in here, Dr. Jack Resnick, the president-elect of the American Medical Association, said the plan's denials had become widespread. The organization has been aggressively lobbying lawmakers to impose stricter rules. Prior authorization intended to limit very expensive or unproven treatment has spread way beyond its original purpose. When patients cannot get approved for a new prescription, many do not fill it. And then they don't even tell their doctor about it. So it's just something that falls through the cracks. It could have been really important. Appeals end up unfairly burdening patients and often take precious time, some doctors said. We are able to reverse this some of the time, said Dr. Patel, a cancer specialist who serves as a chief executive of Carolina Blood Cancer Care and president of the Community Oncology Alliance. But his efforts to fight like a hawk to get approvals take him away from many other things. So they have to go through hoops and ladders and jumps and file paperwork and appeals to get something that they have said is necessary, especially, again, if it's something significant. It's just crazy that they have to do what they have to do to get it approved. So anyway, I wanted to make sure that we understand the differences between original Medicare and, again, original Medicare A and B with a supplement, super low out of pocket, all the freedom, flexibility, do anything you want, go to any hospital, any doctor, anywhere in the country. Managed care, most of those plans, especially the ones you see on TV, are HMO-based plans, which are very small networks, localized area, have to ask for permission, have to get a referral in many cases. There are options of PPO plans that cost more, but for the most part, people get pushed into these HMO plans and they don't know until it's time to have something significant going on. So I hope you found this helpful. Stay tuned. I'll show you how to download my book, Medicare Made Clear. It can help you figure out all the other parts of Medicare. And then we're super happy to help with any of it. So hope you found this helpful. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. Here are a couple other things that you'll also find helpful as you go through Medicare. The first one is a copy of my book, Medicare Made Clear. You can download it right now for free. I've put a lot of time and effort into this book, and you'll see I cover just about every piece of Medicare, and I've written it in a way that makes it pretty easy to understand. Now, I also have videos throughout the book, so if you don't want to read through all the information, click on the video and I'll explain it all to you right there. You'll also find all the links that you need to either sign up for Medicare or things that you're going to need now or in the future when things come up related to Medicare. So take just a minute. Go to medicareonvideo.com/free book and you can download it right now. Now also make sure once you're in Medicare that every year you come back and visit Medicare Price Check. This is my other website where I make it super easy for us to compare our current coverage against new plans that may be less expensive. And remember that Medicare supplements are standardized. So it doesn't matter which insurance company we use, we'll still have the same Plan G or the Plan N that we have now, but hopefully we can get it at a lower price. So visit MedicarePriceCheck.com. Real easy. We'll email you the quote. If it makes sense, then we'll do it from there. So hope you found all this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please download my book, watch some videos, subscribe to the channel. Have a great day.